Hello, everybody. This is your friendly neighborhood massage therapist, and today we're going to discuss some of the muscles of the neck and some of the muscles that aren't attached to the neck but may be causing you some neck pain. We're going to start off on the back with everybody's favorite muscle, the trap. Here, we're using the Muscle Anatomy 3D Anatomy app, and it's a really great app. I would suggest anybody to get it, and it provides video for the muscles. Now, your trap is divided into three sections: an upper, middle, and lower trap. As you can see, the upper trap is elevating the scapula. The middle trap right there is pulling the scapula towards your back, and your lower trap, which is down here, depresses your scapula, brings your scapula down. And I have a rule: any muscle that is attached to a scapula or to a skull or to a first rib or a rib or any of the spinous processes of the neck, which is C1 to C7, they may cause you neck pain. I'm going to get rid of that trap because we're going to move on. We're going to continue working. And we're working from superior to deep. So these are the outer muscles to the deeper muscles. Now, your lat's an interesting muscle. It's not attached to your neck at all. As you can see, it starts over here at your tailbone and it runs to your humerus over there. And I'm not making a joke. It's definitely not attached to your neck. There's your neck, there's your tailbone, there's your neck, there's your tailbone, there's your neck. And but anything that's attached here, I'm going to show you later how this, right, how tightness in your lat going in this lower lumbar region may be affecting your neck. All right, so don't forget it. That muscle right there, we're gonna remove. And I love this app, as you can see, because you can get you can zoom in, you can rotate, you can look at a lot here. Our next muscle up after the lat is our rhomboids. Now we got a rhomboid major here. It's called the major because it's bigger. We got the rhomboid minor because it's smaller. I I I I I'm not a huge fan of the rhomboid major affecting the neck, but I have noticed that when people try to rotate their neck from time to time, when they start getting hinks in the neck, they start complaining and they say they feel it right here. And so I tend to massage, and sure enough, I'll run across a bunch of knots going through that, but it's not on my list today of my top 20 muscles that are affecting the neck, and it's not attached to the neck; it's attached to the scapula. But as I have that rule, anything that attaches to a scapula can affect the neck. Rhomboid minor. Rhomboid minor is different from the major because it is attached to your neck. It has a C7 to T1 origin and attaches to the scapula. It does have an effect on the scapula. It does that. It brings it back. It also does that. It does that little rotation. As you can see, that clavicle is moving. Clavicle is moving. If your clavicle is moving, you may be having a neck, effects on the neck. So we're going to remove that as well. We already removed the rhomboid. We're going to go to our next muscle that is everybody's favorite, another favorite muscle is the levator scapula. That's right, the levator scapula. This Hogwarts sounded muscle is deep in the neck here. It originates at your C4, your C1 to C4, and it goes to the top of your scapula. But what's more important about this muscle is this right here: the amount of nerve tissue that's there. I'm going to hollow this out real quick. Boom. I'm going to hollow that out real quick so you can get a better view of what this looks like. And that's that levator scapula. And as you can see, it goes deep into that neck, all the way deep into there. How do you massage that, right? Well, as a massage therapist, I tend to start right about here, right between the splenius capitis, and I actually go down to these fibers right here. You can see all that nerve tissue that's all over there, and you tend to get knots. We tend to get the knots right before that nerve tissue starts to hink it up. And once you start hinking up the nerve tissue, you're going to start to feel some weird things go down the side of your neck, go down your arm. Yeah, this levator scapula is a big one. And we'll discuss this, how you can knock that out with yoga blocks. For right now, I'm going to remove the levator and I'm going to bring these guys back. I'm going to bring back this guy. I'm going to bring back this guy right here, and we're going to move on to your splenus capitis, which is what I'm on right there. That is your splenus capitis. And the splenus capitis muscle, we've zoomed in on it. It is a muscle that originates at the ligaments and at your C7 to T3. That's your C7 to T3, but it attaches to the mastoid of the skull over there. And let's take a look at what that does. Look at that. Definitely affects the neck, right? It may not be directly attached to the neck. It's kind of directly at the C7, which is at the base, but it moves your skull and it rotates your skull. And things that move and rotate your skull can cause you see how you can have a flexion here. If one side of a spinous capitis is tight, all that muscle gets crunched up. Look at that. Look at it gets all crunched up. And that's how you get more knots in more complex parts of your body. Uh, so that's definitely a muscle worth massaging. What's good about this one, not near a lot of neurological supply or arteries. It's a good muscle that you could run from here up to the neck and down and not cause too much pain. It's not as deep. It's not a deep muscle, right? So you don't need to push too hard. You actually just need to you need you need to follow it. And that's my greatest massage tip to all massage therapists out there. Start at the origin, go to the insertion. We're going to remove that muscle and we're going to go to the splenus cervicis. That's boom, splenus cervicis. That's that one right there. Splenus cervicis is another weird one. It originates down here. It originates from your T3 to your T6, but guess where it attaches? It attaches to C1 and C3. So C1, cervical 1 and cervical 3, these are neck bones. Neck bones, deep, look at that, deep in the neck. And there's a lot of supply. You've got arteries and veins going over there, right? So usually you're not massaging all the way deep into that part of the neck because you want to avoid a lot of those. I suggest stretching this part of the neck. I'll show you some techniques later on in a later video. But I tend to work this spinous capitis going down. I actually start from right about here. I pass that vein. Usually there's a couple muscle tissue over that. And also these muscle tissues and nerves, they move around when you massage. So you're a little bit safer than you think. But if you get bruising around the neck, it's usually because of that vein structure right about there. Now, I usually go all the way down to these parts right here. And again, those are not attached to the neck, but they don't, let me correct myself, they don't originate at the neck, but they do attach at the neck, and so they do affect the neck. All right, and we're going to remove that one. We're going to remove spinous capitis. Boom. We're going to go to our serratus posterior. That is right here. Serratus posterior is a special muscle. It has a special place in my heart. It originates at your C7, goes to your T3, but it's an odd one. It inserts at your second and fifth ribs. It goes to a rib cage. I know it looks like it goes to a scapula, but it really goes to a rib cage, and we don't have a video for this one because it's just odd. How do you explain it? It just kind of opens up your rib cages in your back and helps you breathe. So if ever you're breathing and you feel like you have neck pain around your C7, C6, guess what? It's going to be this one. So massage therapists out there, if your client comes in and says, every time I'm breathing, I've got neck pain, it's driving me crazy. I have to look down. If I try to look up, my neck hurts. It's this muscle. That's your guy. So, I usually go each fiber, I run each fiber going down to the rib cage. And sometimes I'll go under that scapula and I'll get those muscles because trust me, if you're breathing and you have neck pain, it's that one. Now, our next muscle, iliocostalus. That's longissimus actually. Let's see. Iliocostalus. Iliocostalus, it's not attached to the neck. It doesn't originate to the neck. But it's one of these really weird muscles that you'll feel a lot of the times when you have neck pain, and you'll feel it right about there. You'll feel it right about there when you move your neck, and why? It's an odd question again, but it attaches. It originates really deep down over here at your sacrum, and I'm going to show you how any kind of problems in the sacrum could be affecting your neck. This muscle, iliocostalus, goes right to about your T1, and so it's just before the neck. And there's some other muscles that we've discussed today that, like serratus posterior, that starts at C7 but crosses to T3. Right? There's a little bit of crossover between that T3, T2, T1 tightness causing your neck pain. All right. So longissimus is on my list, and iliocostalus. They're both on my list, but this is the iliacostalis right here. I'm gonna remove iliacostalis, and we're gonna talk about your first rib, your first rib. We're gonna remove your intercostals as well, and we'll talk about intercostals maybe a little later. Right, this is your first rib, right? First set of ribs up here, and they're attached to that C7. So that's what I was saying. Remember when I was saying that your first rib, your first set of ribs can affect your neck? It's because of that. That's your C7 right there. And that right there is your T1. So that first rib, anything attaching to that first rib, that can cause you to have a problem. Uh, the next thing we're going to talk about the semispinalis capitis. All right, semispinalis capitis. That's this one right here. It's a beauty. Look at that. Attaches to these spinous processes right there. And boom. Let's talk about it. It originates. It originates on the transverse processes. These are these little projections that come out of the side of the neck, bones themselves, and they go to what's called the nuchal line of the head, which is that right over there. So it's attached onto that nuchal line. So this directly affects your neck. All right. What does this muscle do? Let's take a look at what that muscle does. Boom, look at that. Brings your neck back, makes your head move to the side. Can't deny it. If you've got a knot in this muscle, it's going to affect the rest of the neck. We're going to remove that muscle, and we're going to talk about our semispinalis cervicis. That's this guy right there. It originates from your. There's two sections. There's an origination that originates all the way down here at your T1 and your T6, but it also goes from these C2 to these C2 to C3. It goes to the nuchal line right over there as well. And we got a video of that. Look what it does. That definitely can cause you neck pain. Do I massage this? Oh yeah, I massage all of that. I grab with my hands right about there. I'll grab with my fingers and pull the skull back, and I usually will stretch that muscle or get a thumb on it and knock out knots there. So the next three muscles, I like to talk about them all at the same time because they're an interesting set of muscles. They're pretty close to a few arteries in the neck, so you always want to be really careful with them. And that's these guys right here. That one is your rectus capitis. It, it, it attaches to your what's called your axis or your C2, and it starts over at that nuchal line. Your next muscle is this one right here, the obliquus capitis inferior. This is another muscle that's really close to a lot of vein structure. And so a lot of these I would stretch. These aren't muscles that you want to be putting a thumb too close to. I will rotate the person's neck a little bit right here and then maybe put a thumb on that from time to time. But that's a rarity. They have to have some really deep neck pain, and they have to be like, you know, safe. They have to be safe clients that I trust and that are willing to let me work that deep. Because any kind of weird movement there, you could be hitting structure that you don't want to. We're going to remove the rectus capitis as well. So, because we're trying to get into some of these deeper muscles and get a good view of what's there. And that right there, that is your first bone of your neck in there. First bone that's your C1, also known as the atlas. And we have a muscle there called the rectus capitis posterior. We talked about the bigger one. This muscle isn't almost considered a muscle anymore. Some people consider it a sensory organ, special muscle. All right, we're going to remove that. How do you work those muscles? Again, this is all stretching. I like to hook at the back of the neck right there and pull the skull back. And I'll put a hand usually right over on the scapula to increase the stretch of the neck. We have deeper in here, right there, the obliquus capitis superior. Again, that muscle, you've got an artery and a vein coming right out through there. And you see where that atlas is. It's deep in there, deep, deep, deep in there is the atlas transverse bone right about there. And you can see how much artery is there. That's not a muscle that I usually massage. That is a muscle that, again, with stretching or even icing, gets better. That's the safer way to knock out that muscle. We're gonna remove that muscle. We're gonna go to number 13, the multifidi. All right, we're getting into some of the hairy muscles of the body. Those are your rotaries. Let's find those multifidi real quick. We're gonna zoom out. Multifidus. That right here is the multifidus muscle. And what's interesting about multifidus is that it runs the entire spine. It goes. We're just gonna move that. Boom. It goes all the way to your tailbone over there. And anything that's going to that tailbone, like I said, look how far this goes. It goes from your tailbone to your neck. To your neck, right? So multifidi, what do they do? Let's show this video real quick. Look at that. It brings your whole body back. It brings your neck back, brings your spinous processes back. It attaches this to the spinous processes, but originates at the sacrum. Look at that. Rotates your head and neck, usually all together, but look at that. See how everything starts to shift? If you get tightness in down in here, right? The nerve supply is down here for that muscle, right? If you start getting problems down here, look at it. It goes all the way to the neck. You're going to get crunching happening throughout your entire spine and neck because of that muscle. All right, we're going to get rid of that, and we're going to go to our spinalis muscle. Spinalis. That is your spinalis muscle. Spinalis is an interesting one. See, it's starting down here, right, all the way in your lumbar region, and it goes all the way over to here, all the way to your C7 is actually the origin. It goes from C7, so it starts there really, and it goes to there. It actually attaches in the lumbar region. And spinalis, like I said, anything that's attaching to your C7 is going to affect your neck. As you can see, this brings your entire neck back with the rest of your back. So it's not just your neck that's moving back by this muscle. It's also your back. It's kind of like a synergist to cause extension of the neck. We're going to get rid of that one. We're going on to our next muscle, the longissimus. This is one of my favorite muscles. Again, this is your tailbone. I didn't think your tailbone was attached to your neck, but look at it. It starts here, right? Okay. That's your tailbone. That's your tailbone, right? And the nerve supply for that is way down here. It's down here. Nerve supply for that's down here, right? And then it runs all the way through, and it's attaching to each one of these little spots of the rib cages here. And then look at that. Longissimus goes all the way to that mastoid process right there, that mastoid process of your skull, right? So when it's attached to your skull like that, it moves everything from that skull synergistically together. Look at that. Look at that motion right there. So if you have some tightness down in your tailbone, and if you have tightness in your lower lumbar, you're starting to deviate these muscles in your neck. Starting to deviate those. And boy, who would have thought that a sacral muscle can affect your neck? Totally does. All right. We're getting deeper into this body. We're going to talk about our semispinalis dorsi, and this is a hard muscle to find. Semispinalis. Those are your rotaries. That's one of my favorite. There we go. Semispinalis dorsi, right there. Look at that muscle. Beautiful muscle right in there. Now, it originates at the transverse processes of your T6 to T10. It's down here. And it skips your T11, decides to go to your T12. But guess where it attaches? It attaches to your C6 to your C7, pulls your neck back. Look at that. It does a little bit. Okay, it does a little bit of rotation. Helps with the rotation of the neck. My mistake. Helps with the rotation of the neck. So obviously this is a muscle to work on, to massage, but how are you getting there? It's deep, deep in there. Okay, that's a deep muscle. That's for your deep tissue massage therapists. Those are for the ones that know how to get into in between the rib cage and the spinous process without affecting your nerves. You know, you could see that these bulbous processes right in here, these nerve roots are coming out here. So you don't want somebody that's so deep that they're knocking into that. That's dangerous. That's where you start getting nerve damage. So this is where the yoga blocks again are a key way to affect these muscles without actually, affecting your nerve roots. All right, we're gonna remove that muscle. We're gonna talk about the rotaries. Each one of these muscles right here, they're so annoying because if you look at them, they start off at the spinous process, and the spinous process is that hook right there, that hook, and where it's going is to a transverse process. So on the opposite bone. So basically, the way I describe it is that it starts on the transverse process, the spinous process of a superior disc. So a disc above, that's where it starts, and it goes to a disc below. All right. Each one of these have branching innervations, and each one of them, they don't necessarily work independent of each other. They work kind of together at rotating the back. So you can have a neck rotation, a rotation of the neck that's causing your neck to lock because of one of these guys. And I will go through each one of those from time to time. I will go through each one of those. It's kind of hard because you have to kind of start right at the edge of the top of the bone and go to the next part of the spine. Got to be careful when you do those, but it's if you know how to do that, you're a very skilled massage therapist, and clients are definitely coming back to you. Now, we're gonna go to the let's see, what do we have left? This guy, this guy. No, oh, they're so small. They're so hard to get to. That one. There it is. Boom. The interspinalis cervicis. Quite a few small muscles. As you see, they're attached to each of the spinous processes of your C2 to about your C5. This kind of helps with bringing again the neck back, so you can easily have knots in there. And each one of those, sometimes you got to go through them. Very skilled massage therapists are the only ones who are likely going to be going there because they know that muscle exists. Ready to get rid of that guy. And we're going to end. Oh, we're not ending yet. We're going to go to another one of my favorite muscles that are quite wild. This one, interreversi. Look at this muscle. This muscle is going all the way to your neck. See that little green spot deep down in there? Each one of those guys are on nerves too. So when your interreversi is affecting you, you could be choking off nerve supply, getting worse and worse inflammation in your neck. And that inflammation, because again, when we're in these areas, you got things like astroglia, you got these different kinds of, white blood cells that come out of here, monocytes that can cause inflammation of the neck, creating a lot of pain, a lot of issues. But here's the kicker about interreversi. Look at where this muscle actually is. This muscle innervates way down in here. So I'm gonna remove some muscle back here so we can get a good sight of what is it. And that's your quadratus lumborum. Look at this muscle down here. What is it? How is it? How is this a thing? This muscle again runs to your sacrum, runs to your sacrum, runs to the inside of your sacrum, and look at all that nerve supply. I'm gonna get rid of that serratus posterior so you can see it. Look at that nerve supply. This muscle has lower lumbar nerve supply, but it's split into three. People split this one into a lumbar, a thoracic, and a cervical. But let me tell you, the majority of the nerve supply is down here. Anybody that has disc issues, anybody that has issues in this region is gonna have an issue with the neck. It's ridiculous, ridiculous. We're gonna remove that one, and now we're deep here. You can see all those beautiful nerve roots coming out. You can see the cervical plexus over there, and the last muscle I want to talk about. It's one of my favorite muscles. Kind of most people don't appreciate it as a neck muscle because it's not really a neck muscle. This is called your serratus anterior. See that? It actually originates back here. And so I consider it more of a back muscle, but it's not a posterior serrati muscle. It is an anterior, which means it actually starts all the way in the front. See, it's a front muscle that wraps around your rib cage, but goes behind your scapula and it goes to that rib cage. Goes to that rib cage there. So anytime a muscle, remember my rule is anytime a muscle goes to that first rib, you can have an issue. You can have an issue with your neck, right? So that's that serratus posterior right there. Look at the motions. It affects the scapula, affects the clavicle, and you see it right here. Anything that affects scapula or that first rib is going to be a problem. Trust me. All right, we're going to get rid of that, and we're going to talk about the muscles in the front of the neck over here. Boom. Platysma. Platysma. It's not a muscle that's attached to your neck. It looks like it's attached to your neck. You might consider your jaw and neck, but it's a funny one. It's attached to the skin of your body. It's usually the skin around your clavicle and the skin around your pecs, and it runs to the skin of the jaw right there. And this muscle, since it attaches to your skull, well, the skin of the skull and the skin of the neck, it can pull on your neck. It's usually the one that's responsible for your head being, pulled down a little bit more. But we're going to remove that one. We're getting into a deeper muscle here. We're going to talk about your sternocleidomastoid. That's this one. Again, this one goes through some nerve roots and it goes through some arterial supply. So this is not a muscle that you're compressing. Quite often, we're plucking it and we're pulling it away from those nerves and away from that supply to keep it safe. So you're not massaging on all of that nerve supply and arterial supply. Definitely don't want to do that, but it is a muscle that needs to be massaged. We sometimes pluck it from here, or sometimes we pluck it from back there. We're pulling that muscle away from the neck. Sternocleidomastoid. This is what it does. As you can see, anything that's going to move the neck that way can cause a crunch or cause the neck to be stuck. All right, we're going to remove that muscle, and we're going to go to the intercostals. We had removed that originally, but the intercostals, I'm going to catch them from this side. They're attached. We removed that sternocleidomastoid, but there it is. Those are your external intercostals, and as you can see, they run in to some of the muscles in that first rib. And you can see how much muscle structure is actually attached to that first rib. You don't want things affecting it, so breathing exercises can also help. And last but not least, we're going to talk about the three major muscles in the front of the neck that causes you neck pain. This is your sternocleidomastoid muscle, right here, sternocleidomastoid. And sternocleidomastoid has so many nerves around it and so much arteries. You're rarely massaging it, but if you are, you're going from here to there. And let me tell you, if you're off just by a little bit, your client's going to tell you. Your client's going to tell you, my arm feels numb. That means you're on an artery. Or I'm feeling a tingling sensation. That means you're on a nerve. Back off if that's happening. All right, right here. That's your anterior scalene. What do these muscles do? They move the neck. They move the neck. And again, it runs through some major carotid arteries and some veins. External carotid artery, you don't want to mess with those that much. This is an area that I ice or rotate to stretch. We're going to remove that one. And last but not least, this guy right here, that is your scalene posterior. And that scalene can affect a lot because it goes to that first rib. All right, guys, that concludes all of the muscles that I believe are important for causing neck pain. And in a later video, we will discuss how you use the yoga blocks to get to those deeper muscles around all that nerve supply that can be dangerous. Have a good day, and let's try to stop some people's pain.